أعوذ بالله من الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. So today we shall be talking about global health quality, and this is one of the most important courses in international healthcare management. So the first thing, as usual, we shall start by reviewing the lesson objectives. So these are the lesson's objectives. That is, by the end of the lesson, the learner should be able to define health quality and explain its significance in achieving what? And explain its significance in just a minute. So, number one is to define health quality and explain its significance in achieving optimal patient care. Number two, identify and describe the key dimensions of healthcare quality. Number three, understand the primary indicators and metrics used to evaluate healthcare quality. Number four, analyze how improvements in healthcare quality directly influence patient outcomes. Then also define global health quality, explain the role of international frameworks in setting benchmarks for health quality. Then describe the mechanisms used to maintain and improve quality in healthcare system. Then highlight the benefits of technology in improving healthcare delivery. Then discuss how technological advancement improve healthcare quality. Then lastly, explain the importance of patient satisfaction as a measure of healthcare quality. So these are our lesson's objective. So number one, we'll define what is health quality. When you're talking about health quality, what comes into your mind? So health quality refers to the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. So this is the definition of healthcare as per the World Health Organization. So according to the World Healthcare Organization, they are basically talking about the degree to which health services for individuals and population increase the likelihood of desired health outcomes and are consistent with current professional knowledge. So when you're, for example, if you're having an hospital and if people visit the hospital and there are high chances that they might feel better after visiting the hospital, then we can easily say that that hospital has good quality. Now, what are the dimensions of quality in healthcare? So these are the metrics of the World Health Organization. So for quality to be there in health services, then these 6 things must be there. So number one, safety, avoidance of harm to patient during care delivery. So when patients comes or goes to the hospital, they should feel safe. They should not be harmed. Number two, effectiveness. Effectiveness means providing evidence-based care that produces desired outcomes. So the hospital should provide care that is evidence-based, care that is scientific, care that is informed. That is the meaning of effectiveness. Number three, patient-centeredness. Respecting and responding to individual patient preferences, needs, and values. So quality can only exist when we respect the patients, when we respond to their preferences, their needs, and their values. Timeliness. reducing waits and harmful delays in receiving care. If somebody comes to the hospital, he should get care in a limited time of time, in a limited frame of time. But if the patients come to the hospital and he's taking ages and a lot of hours to be treated, then that hospital is not qualified. That hospital is not giving quality services. Efficiency, maximizing resource use to avoid waste. Then equity, providing care that does not vary in quality due to personal characteristics such as gender, ethnicity, or socioeconomic status. For quality to be there, we need to give equal services. So it doesn't matter where you come from, what your background is. Are you poor? Are you rich? No. The quality should be the same. So if you find that you're going to a hospital and the quality is varied, it's not the same, then there is a problem with that hospital. Now, what are the key indicators and metrics for assessing health quality? If we want to measure quality, what are the standards? What is going to help us to know that there is quality in this hospital? So indicators and metrics are what? These are the tools used to measure healthcare quality, often categorized into three: structure, process, and outcome. So these are the three metrics that we can use to measure quality in any healthcare facility. Number one, structure. Structure is about the infrastructure. How is the hospital? Is it big enough? Is it spacious? Is it well ventilated? Staffing. What is the number of staff in that hospital? Availability of resources. Is the hospital having enough resources? So if the answer is yes to all these, then we can say there is quality in that hospital. And we can also look at the ratio of nurse to patient. In some hospital, when you go, the ratio of nurse to patient, for example, you can find one nurse treating 5 patients. But in Africa, it's even worse. You find that a ratio of 1 patient to around 50, one nurse to around 50 patients. Then number 2 is the process. Process means what? Actions taken in delivering care. That is, for example, percentage of diabetic patients receiving annual eye exams. So here, basically, you're talking about any action the hospital is taking to deliver care. Then lastly is the outcome, results of care provided. That is hospital readmission rates within 30 days of discharge. So here, we are basically talking about the results. If the patient is being readmitted even before the end of 30 days, then it means that the patient did not get enough care, you know. But if, for example, the patient is being readmitted after 4 months, 5 months, so it means that the quality of that hospital is good. So it means that they gave the right kind of what? The right kind of treatment. And there are other metrics. There are other key indicators and metrics for assessing health. There are very many. These are just another thing we can use to know if there is quality in an hospital. There is what is called patient satisfaction score. These are surveys measuring patient perception of care received. So in many hospitals, you'll find that there is a questionnaire. Like they ask the patient, how was our service? Did you like our nurses? How was the treatment? So through the feedback of the patient, we can know what is happening. This is what we just saw, readmission rates. The percentage of patients who return to the hospital within 30 days of discharge, indicating potential quality issues. You know, so if a patient is coming within 30 days, so it means there was a problem somewhere with the treatment. Adverse event rates, tracking incidents that resulted in harm to patient, such as medication errors or infection. If you want to know if a hospital has good quality, we can track the number of medical error, the number of surgical errors. Clinical outcomes measures, metrics such as mortality rates. How many patients, how many kids maybe died at Hayat Hospital or at Boroma International Health or Boroma International Hospital this year? Complication rates and survival rates from specific diseases or treatment. So all these metrics can help us to know if there is quality. Now, what is the relationship between healthcare quality and patient outcome? Is there a relationship? Like, what is the relationship between quality and patient outcome? Is it a positive relationship or is it a negative relationship? So, positive relationship, higher healthcare quality often leads to improved patient outcomes. So this is a positive relationship. Any hospital that has good quality, then it will directly correlate to what? To improve patient outcomes, such as there will be lower mortality rates, reduced complication, and higher satisfaction. But the opposite is also true. Negative implications of poor quality. Inadequate care can result in what? You find a lot of medical errors, increased morbidity, prolonged hospital stays, and higher healthcare costs. So all these are related to what? To poor quality in hospital. And there are some factors linking quality and outcomes. Adherence to clinical guidelines. Some hospitals, they adhere to, they follow the guidelines. Some hospitals, they don't follow. Where they follow, the patient outcome is good. Where they don't, the patient outcome is not good. Timely and accurate diagnosis. So a patient comes to the hospital and immediately he comes, the necessary test is done, and we accurately tell the patient what the problem is after the thorough diagnosis. Effective communication and coordination among healthcare providers. Now, relationship between healthcare quality is still the same thing. So the relationship between healthcare quality and patient outcome is fundamental to understanding effectiveness in healthcare delivery. High quality healthcare typically results in better outcomes. This is what we said before. Positive, higher healthcare quality often leads to improved patient outcomes. So this is just the same thing here. High quality healthcare typically results in better patient outcomes. What are the better patient outcomes? Improved recovery times, high rates of survival, and enhanced quality of life, decreased complications, and lower hospitalization rates, greater patient confidence, and adherence to treatment regimen. Now, that was our introduction to what quality is and what are the dimensions of quality and the relationship between quality and health outcomes. So number 2 is now the definition of we're going global. What is the definition of global healthcare quality? So global healthcare quality refers to what? The standard of care provided in healthcare system across different countries, emphasizing safe, effective, and patient-centered services. It considers cultural, economic, and environmental factors that influence healthcare delivery, aiming to improve health outcomes on a global scale. So when you're talking about global health quality, you are basically talking about the standards of quality available in other countries. So it should be the same. The kind of standard you find in Somaliland, if you go to Ethiopia, it should be the same standard. If you go to Djibouti, it should be the same standard. So global healthcare facility encompasses both access to care and the effectiveness of care received. So when you are talking about global healthcare, is that number 1, access to care. Is it easy to get healthcare? If the answer is yes, then there is the element of quality. And number 2, the effectiveness of care received. So it is not all about getting, it is also about the quality of what you are getting. Ensuring that all population, particularly undeserved groups, these are the vulnerable groups, receive equitable and high quality health services. Now, the international frameworks for quality assessment. For example, the WHO guideline. So the international framework for quality assessment provide guidelines and standards that countries can adopt to ensure high quality healthcare. One of the primary framework is the World Health Organization guidelines, which so all the countries in the world, they have to follow this framework or guidelines provided by the WHO. And these guidelines, they promote for, number one, the quality of care. So the guidelines provide or establish standards for safe, effective healthcare that is responsive to patient needs and respect their rights. That is number one. Number two, patient safety. Implementing best practices to reduce medical errors and improve care outcomes. Number three, service delivery. Encouraging integrated health services that meet the needs of population and address health disparities. Then lastly, monitoring and evaluation, developing mechanism to assess healthcare quality and implement improvement based on data-driven insights. So the guidelines and the framework the WHO is giving is basically promoting these four things. Now, let us go into detail to look at this framework. So we have the WHO's quality framework. What is the purpose? The WHO organization established a quality framework to guide countries in improving healthcare services and achieving universal health care, universal health coverage. So it emphasizes, this is the framework, it emphasizes the delivery of number one, high quality care, number two, that is accessible to all, irrespective of socio-economic or geographic disparity. So that is just, the framework is just focusing on two areas, high quality care and the accessibility. Now, this is what we saw before also. The WHO identifies 6 dimensions of healthcare quality. So this is what we saw before. Now, for quality to be there, WHO is saying, number one, there is what is known as safe. Avoid harm to patients when they visit your hospital. Effectiveness, what we said before. Use evidence-based practices to achieve desired health outcome. Evidence means scientific, based on data, evidence that is objective. People-centered, we need to respect individual preferences, values, and cultural needs. Timely, we need to reduce unnecessary delays in receiving and providing healthcare. Then efficient, optimize resource use and avoid waste. We should not do a lot of israf. We should not do a lot of waste in the hospital. Then equitable, provide consistent. Consistent means the same kind of treatment to all the kinds of patients who are visiting the hospital. So provide consistent quality care across all population without discrimination. Now, what is the implementation strategy for these 6 dimensions? So the WHO provides countries with guidance, documents, toolkits, and policy recommendation to integrate quality improvement into their healthcare system. So you'll find that the WHO, it normally gives every country a copy of the documents, a copy of the toolkits, a copy of the handouts that can help countries implement all this. So number one, we have the WHO. This is one of the international organizations. Number two, we also have the Joint Commission International. So this is also one of the international organizations that normally assures that quality is being implemented in the health facilities. So the Joint Commission International is a global leader in accrediting healthcare organizations to improve safety and quality. So they normally give your hospital a certificate. So if you go to any hospital and they are having the Joint Commission certificate, it means that their hospital is providing good quality services. So this organization or commission, it normally focuses on 3 key areas. Number one, patient safety. That is implementing systems to reduce medical errors, such as infection prevention protocols. Number two, clinical quality, ensuring evidence-based practices in diagnosis and treatment. Then number three, leadership and governance, establishing accountability, frameworks for quality and safety, oversight. So these are the 3 areas they normally focus on. So for you to get their certificate, there is what is known as accreditation process. So the JCI conducts regular evaluation and inspection. They will come to your hospital. For example, they can come to Abrar hospital. If Abrar wants the certificate, they will come to Abrar, they'll do evaluations, inspections. Then after that, if you qualify, they will provide certificate to organization meeting its standard. If you have their certificate, it means that you are giving quality services. So accreditation demonstrates a commitment to global best practices. What is the impact of this certificate or of this accreditation? So the JCI accredited hospital often report higher patient satisfaction, fewer adverse events, and better clinical outcomes. If you go to any hospital that is providing or that has been accredited by the Joint Commission International, you will always find that patients are satisfied with their services and their positive outcomes. Number three, we also have this institution, which is called the Institute for Healthcare Improvement. This is the 3rd international organization. So this is a non-profit organization which also focuses on improving healthcare quality, safety, and cost efficiency worldwide. So key framework, they also focus on 3 areas, which are known as the triple aim. So the Institute for Health Improvement Triple Aim Framework emphasizes 3 interrelated goals, means that these goals are interdependent. Number one, improving population health. That is enhancing the overall health of communities. Number two, enhancing patient experience. They are focusing with delivering high quality, accessible, and respectful care. Then number three, reducing cost, achieving financial sustainability by improving efficiency. So these are the triple aim of the Institute for Health Improvement. Now, it has a lot of global initiatives. So the Institute for Healthcare Improvement collaborates with governments. It works closely with governments, health system, with hospitals and organizations, the NGOs, to do what? To design and implement large-scale quality improvement projects. For example, they have the 100 Million Healthier Lives campaign, which is aimed to do what? Which is aimed at improving the health and well-being of 100 million people globally by addressing social determinants of health and the core quality. The key tools and techniques. So these institutes provide resources like the models for improvement. So they normally provide also their guidelines or their kits, which help healthcare organizations test and implement changes quickly and effectively. Now, what are the quality assurance mechanisms in healthcare system? Quality assurance, if we want to assure, if like we want to really assess and evaluate that your hospital is giving the necessary quality, what can we do? So number one, there is accreditation and certification. Accreditation means what? A formal process in which healthcare organizations are evaluated against predefined standards to ensure quality and safety. So number one, this international organization, they come to your hospital, to evaluate you. This is what is known as accreditation, the process of evaluating that hospital to see if they meet the standards. Then number two, certification. A similar process focusing on specific services or practices. For example, we normally have the ISO certification for quality management. ISO is also an international organization. For those students who have done management, they know what is ISO certification. So if any organization is having ISO certification, it means that their quality is excellent. Number three, what is the purpose of this accreditation and certification? It helps to establish credibility. People will trust you if your hospital has been accredited, improve patient outcomes, and ensure compliance with global or national standards. If your hospital has been accredited, it means that you are giving international standards. So people will prefer to come to your hospital. Now, we have some quality improvement initiatives and strategies, like how can you initiate quality programs in your hospital or health facility? So what is the meaning of quality improvement? These are the continuous efforts to enhance the quality of care through systematic analysis and improvement of processes. So quality is not a one-time thing. Quality is something that is continuous, mustamirra, you know? So these are all the efforts that we put in place to ensure that when our patient comes to our hospital, anytime they come, they get the same quality. And there are some key strategies that hospitals can do. For example, there is the Plan, Do, Study, Act. This is a cycle for testing changes in small-scale implementation. During your free time, I need you to go and research more in the internet about the, so you plan as a hospital. If you finish planning, you do. If you finish doing, you study to see what, if the initiative is working good or if it's not working good, then you act. Then we also have the Lean and Six Sigma. These methods are aimed at eliminating waste and reducing variability in care delivery. Then lastly, patient safety campaign, initiative like Zero Harm to minimize errors. So these are some of the key strategies that healthcare facilities and organizations can use. Now, the impact of technology on healthcare quality and access. So how has technology really helped the healthcare facilities implement their quality initiative? What is the impact of technology on healthcare quality and access? So number one, like we've been seeing it all throughout our courses, there is what is known as telehealth and telemedicine. Through this, the telehealth and telemedicine, it has improved access to healthcare. People can get care wherever they are. You can just be in your house and you can get the necessary consultation, the necessary advice from the doctor. So telehealth refers to the broader use of digital technologies to deliver healthcare services remotely. So you don't have to go to the hospital. This includes virtual consultation. You don't meet with the doctor physically, you meet virtually, remote monitoring, and health education. Telemedicine it's a subset of telehealth. It's a subset. Subset means it is under telehealth. It's focused specifically on remote clinical services, where patient consults with doctors through video calls, phone calls, or messaging platforms. So what are the benefits of this? Number one, increased access. Now, many people can get access to healthcare. Cost effective. It is not expensive. You just have to have internet connection. It's convenient for patients who cannot who cannot walk. You know, it is timely and it is convenient. There are some patients who are very old. They cannot walk. Efficiency. facilitates follow-up, post-surgery monitoring, and routine checkup without the need for in-person visit. You don't have to physically visit the hospital. Now, what is the challenge of this telehealth? The digital divide, some people, they don't have knowledge and capacity of using the digital applications. Privacy concern, there are issues related to privacy, and the need for robust infrastructure. In some countries, they don't have good infrastructure for the internet, electricity, so it's very difficult. Now, the digital health records and their impact on quality of care. Nowadays, we also have what is known as the digital health records. Leave alone the physical health records, where they put your records on files, they have to open, they have to search your file when you go to the hospital. But nowadays, you have the digital health record, which it has really improved the quality of services. So the electronic health records are digital versions of patients' paper charts. This system provides real-time, patient-centered records that make information available instantly and securely to authorized users. So with the electronic health record, with just a click of a button, all your health history and record can easily be retrieved. So what are the benefits of these digital health records? Improved coordination of care. There is also accuracy, because there is no human error. Efficiency and time saving. You just click a button. Better decision making. But what are the challenges? The challenges of the digital health record is very expensive. There is the data security and ensuring that systems are interoperable across various platforms. Interoperable means that ensuring that the system is basically the what? Is basically the same across all the platforms. Then innovation in medical technology and their role in enhancing care. We have different innovation in medical technology that has really helped in enhancing care quality. Number one, you have wearables. These are devices like smart watches and fitness trackers can monitor vital signs, e.g., heart rate, blood pressure, and oxygen level, helping patients and doctors manage chronic condition more effectively. So now you can just normally wear a smartwatch, and it can help you to monitor lots of things in your body. Number two, artificial intelligence. AI-driven tools assist in diagnostic processes by analyzing large data sets. AI can analyze a lot of information and identifying patterns that might not be visible to the human eye. Sometimes there are some patterns that we cannot, as human beings, realize. AI is also used in radiology, pathology, and predictive analytics. Robotics, we have surgical robots enable more precise and minimally invasive surgeries, improving recovery time. Nowadays, robots, they do what? Surgery. Then the 3D printing, used in creating custom prosthetics, implants, and even bioprinting tissues, ensuring personalized care. Now, what are the benefits of technology in enhancing healthcare? Number one, there is accuracy and precision, personalized care, efficiency, and cost reduction. But the challenges with, of course, technology, it is high initial cost. If you want to implement this AI and the wearables, initially you'll require a lot of capital, a lot of money. The need for continuous training of healthcare professionals. You'll always need to train your healthcare professionals, and regulatory concern around new technologies. When the new technologies come along, then there is also some rules, some laws guiding them. Now, measuring patient satisfaction as an indicator of healthcare quality. So patient satisfaction is a critical metric for evaluating the quality of healthcare services. So through the patient, We can know if our quality is good or bad. If patients are complaining, it means our services are not good. If they are not complaining, it means our services are good. So below are key points about the relationship between patient satisfaction and healthcare quality. Importance of satisfaction. Patient satisfaction serves as a reflection of the overall patient experience, encompassing not only the clinical outcomes, but also the emotional and psychological aspects. High level of patient satisfaction are generally linked to better health outcomes. This is what we said before. How can we measure patient satisfaction? We can use surveys and questionnaires like we said before. Direct feedback, we can ask the patient directly to get their immediate feedback. We can have focus groups and interviews. All this can help us to get their feedback. What are the key factors affecting patient satisfaction? Number one, communication. Clear, compassionate communication between the patient and healthcare provider can help us. The patients will be satisfied if there is good communication. Timeliness of care. If we give them the care within the time, quickly, if we give them the words, if we give them the care quickly, they'll appreciate. If our quality is good, they'll appreciate, and the personal care. So we have only 2 minutes remaining. So you will finish the other part. There are like 3 slides remaining. You will read it on your own. Okay, that's all. I've already taken the attendance. So we'll meet tomorrow. Tomorrow will be our last lesson. Next week, you'll be having a quiz. So the quiz plus the research, then that will be your assignment. So you'll have a quiz plus the research, then it will account for the 20 marks of your assignment. Is it clear? So that's the end of our lesson. We'll meet tomorrow, inshallah.